Hi, Jennifer. It's so nice to have you on the show. How are you doing today?
I'm so good. How are you doing?
Doing fine as well. Like I said earlier, thank you so very much for honoring the invite. It means a whole lot. And also,
Anytime.
yeah, I'm so excited to have you on the show for some reasons, all right? Firstly, my interest in seeking knowledge, because I believe that in order to leave a terrible situation, it takes the application of insight, information, quality information. So the second reason why I'm excited to have you on the show is for the sake of those ones that will be listening to our conversation, because I believe that there are some things that Jen knows that some of my audience needs to hear you say this stuff, I mean directly from your mouth, in order to experience transformation. I firmly believe that. And thirdly, that is I myself. I believe I am definitely going to learn one or two things from your insight, your experiences, and your story. So, for that reason, Jen, I want us to get started with your introduction, your journey, how the journey has been so far, the challenges that you faced, and how you overcame them. And afterwards, I've gotten some beautiful questions for you. Okay, Jen, over to you.
So I'm Jenn Johnson. I'm a registered nurse in Ontario, Canada. I have been an ER nurse for about 16 years now, have seen and done just about everything. And worked through COVID, kind of hit a roadblock, and ended up wanting to write down some of my stories for my kids, just in case, heaven forbid, anything were to happen. They'd have some of my work stories, and it might, help their grief if worse comes to worse. I wasn't, going to survive working through COVID, kind of thing. Thankfully, that wasn't the case, but that journal ended up turning into the book Nursing Intuition, which is my delve into the foray of figuring out, why are we so quick to push away the sorry why are we so quick to get rid of the feeling that we don't know what we're doing, our body doesn't know what we're doing, and we're so quick to dismiss the idea of trusting your gut? And especially in the medical world, a lot of it is, is it backed by science, is it evidence-based? And in looking through all the research, there is a ton of research on not only intuition but also intuition specifically in nursing. And with that kind of behind me and pushing me forward, it allows me to then come out and say, hey, like, there is intuition in nursing. It's absolutely a thing. And now it's backed by science. So now that it's backed by science, let's get towards teaching it and sharing it and learning and seeing how it can not only help our patients, but help ourselves as well.
You mentioned some words. You used help by sharing it and putting it outside and teaching it. That's a beautiful one. Folks who think like you do, I truly admire them, because to me it says that you're a good person and you're a good leader, because you've got a solution and you do not want to keep it to yourself. You want to teach other people and put it out there. That's a good one. Okay, so shall we get started with the questions, Jen?
Sure.
Now, you used the word intuition, all right? So,
I'm
how
sorry. I
can
used the word.
intuition,
Oh, yeah.
intuition, yeah. So, how can one bring intuition into practice? Can you talk to us about that?
Yeah. So the number one thing is just if you can put a little bit of faith into the fact that there is more going on than what we can see. We need to start trusting how we feel, and then letting that come into our practice. So when we're seeing our patients, when we're caring for them, and there's something kind of eating away at us to say, like, I don't like how this patient is progressing. I don't like how this patient's looking. I don't like, how the trend of the vitals is going. We need to put some like weight into that and let us know that that is supported by evidence, and we have to then trust it and go forward and, gain the confidence to then go to either your peers or your physicians and say like, hey, I don't know what's going on, but I really don't like the way that this is going. Can you come and have a look at my patient? And again, even if nobody believes kind of the woo-woo side of things, just having the physician come and reassess that patient then still will improve patient outcomes. And so even if you're not 100% sold on the idea of intuition and nursing and trusting your gut, you can trust in the fact that just having the physician reassess your patient and kind of have another look at things will still improve your patient outcomes. And it's taking that and then leaning into it a bit and growing from it and realizing when that feeling kind of comes up and being the one to not quickly dismiss it, just kind of lean into it and embrace it a bit and go, okay, something's happening. I need to take just a minute to figure this out and then see how I can then take that information and run with it.
Brilliant. You know, I feel like you're just so good at what you do. That was well explained. I love that. Okay. Yeah, let us talk about, you mentioned gut. So let us talk about how to leverage gut to help patients. How can nurses leverage a gut to help their patients? Can you dive deep on that?
Yeah, so spirituality and me, I'm not Christian, but I do have a deep faith in that there is more to life than just kind of what we can see and what we can hear and what we can taste and smell and all the senses. Um, but again, it's, could it be that there's more to life and that's what's kind of coming down and that's what's kind of guiding you a bit? Maybe. Could it be that you've got some knowledge tucked into the back of your head that you've somehow seen this scenario before and you're realizing that the patterns are the same and that's what's kind of queuing up your intuition? It's hard to say where this is all coming from, but again, why not lean into it just a little bit? People used to think that the earth was flat until it was proven otherwise. So, maybe that's just where I'm coming from, is that it's going to take time for new ideas and very, very different ideas to kind of come in and come into practice and change things. Do I expect the world to change in a day? Absolutely not, especially the nursing world. But if we can start realizing that we've got so much more power in our positions and in our bodies and in our knowledge base that we need to kind of bring forward, I think that would be absolutely fantastic and would be something that, even if it gains just 1% of traction while I'm here and able to see it, I would be just so thrilled.
Got that. Okay, I just want to know what is um, emergency nursing?
Emergency nursing is coming into somebody's life at potentially the worst possible moment, and trying to have some sort of impact where you're helping. And whether that's you're helping somebody feel better, you're helping them get over pain, you're helping them figure out what's been bothering them. It's all these kind of things where, emergency nursing is so many things to so many people, and it's definitely not what you see on TV. But it definitely is, coming in and being able to help in a moment when somebody absolutely needs it. And so trying to keep that in mind when I'm at work and getting a little frustrated with the process or how fast things are working, or if people are getting frustrated with me and how things are going. It's important to understand that, this is my job. I'm here to help in this moment. I may never see these people again, but there was a famous quote by somebody, and it's, they may never remember your name, but they will absolutely remember the way that you made them feel. And it's that kind of keeps in the back of my head, just to kind of think like, okay, they may never know my name. They may only just call me nurse, and that's okay. But if I can help in that moment alleviate, pain, whether it be emotional pain or spiritual pain or physical pain, maybe that's what I'm here to do.
Thank you for explaining that to me. Okay, thank you. All right, so let us get personal a bit, Jen.
Sure.
Um, what part of nursing do you love or hate?
I I love being able to take somebody from being on, death's door and catching it and turning it around and having them improve right before my eyes. It is one of these miracles that you just can't quite comprehend until you're seeing it. And even if you're seeing it, the fifth time, the 50th time, the 100th time, it's still, you can't help but let it have an impact on you and say, okay, like I helped with that. It wasn't just me, obviously, but me and my team, we were able to help them. We were help them feel better and look them turn around. And now they're going to get more time with their family and be able to experience life a little bit more. And that's one of the best parts. The part of nursing that I absolutely hate is I hate being assaulted first and foremost. Like I really do not appreciate when people hit and kick and spit and call me every name under the book. I can be very patient up to a point, but sometimes you're pushed too far, and it really makes you wonder, why am I doing this? Why do I keep on going? And thankfully, usually those interactions don't last more than, at the very most 12 hours. So you can come home, go to bed, and kind of start over. And you just go, well, that was the way that was going to go. And I can empathize with that person. I don't have to appreciate their behavior, and I definitely don't excuse it, but I can empathize with you to a point. But when I'm having to um, think about filing charges, that's just a whole other level of nursing that they never quite teach you in nursing school.
You know, you're actually doing a great job, I tell you, because I tell you, I just can't see myself doing what you're doing. I feel like that's your purpose and that's your gift, and you're doing it and you're happy doing it, you know. And you've said some amazing things that are really, really inspiring and educating, and I love that. Okay, so we have just two more questions to go. All
Sure.
right. Now, so what does it feel like to trust one's gut? Can you talk to us about that? That feeling of trust in your gut.
Yeah. So when you get that feeling, everybody feels it a little bit differently. So some people get a little bit of a heaviness in their chest. Some people get that deep heaviness, that feeling of a pit in your stomach. Sometimes it's just an idea that kind of pops in your head, like, I don't like this. And it's different for everybody. It does take time to kind of not only recognize what's going on, but trust it. And then a whole nother level to then act on it. So if you're having these feelings, you can always go and ask a coworker. And, we bounce each ideas off of each other constantly. And it's one of those things where it's like, hey, I can't remember how to do this. What do you think? I'm not sure about what I should be doing next. I'm not sure how my patient's progressing. Trust your charge nurse, trust your senior nurses, and just ask. We love when you ask, because it means you're invested and you're learning, and it's so wonderful to see. And if you can find those of us who really enjoy teaching, take us for all we're worth, because it's just so nice to watch people grow into beautiful, confident nurses that know what they're doing and are confident and can advocate for their patients. And it's just one of those things that it's so lovely to watch. So if you're wondering about whether or not you should trust your feelings or not, just ask one of your other nurses and say either, I don't know about this, or I have this gut feeling, or I'm just not sure. You can always say, I'm just not sure. And that's more than welcome enough to one of us for us to kind of then take a minute, check your patient, and then we can either talk about, what is going on. Yes, you are 100% right. Or no, maybe they may not be as sick as you think, but great eye. I love that you're learning. I love that you're pushing forward. And we can talk about how to then make it work more later.
Beautiful. I've got a clap for you. Beautiful. I love that. Okay, Jen, it has been an interesting moment with you. I tell you, I'm really enjoying our conversation. That's a good one. So to bring this to an end, all right, Jen, let's say we have some new nurse or nurses listening to our conversation. What would you like to give to them, like an advice, or what would you want them to know?
You are not alone. You are absolutely not alone in your struggle. You are not alone in realizing that nursing is definitely not what they were trying to pitch you in nursing school. Um, I cried every day after my shifts for an entire year. So please do not think that you don't know enough, or you're not learning fast enough, or you're missing something. It's just that it takes a ton of time to come into it and come into your own where you're comfortable with moving forward and asking questions. But that's just it. Just please ask the questions. We're more than happy to answer them. We understand where you're coming from. We've all been there. And please do not let anybody bully you or belittle you, and think that that's just nursing eating its young and that's totally acceptable, because it is absolutely unacceptable. And, if you have any other options, you're not going to change the culture. So you might as well just get out of there and find another unit, or at least another line on at your work, where you can find people who support you, who are watching out for you, who want to see you grow, and aren't going to be the ones to tear you down, because it's a pervasive culture that we're very slowly changing. But it's not acceptable, and it is absolutely not you.
Okay, thank you for that. All right, Jen, to those ones who got the point of our conversation and they would like to reach out to you, get your book, or learn more about you, how can that be possible?
Yeah, so Nursing Intuition right now is up for pre-order on Amazon. So if you search Nursing Intuition by Jennifer A. Johnson, it should be up there. You can find me at ernurse.gen with two N's.ca. You can find me at rx4growth, FOR growth.com. I'm on TikTok and Instagram at ernurse.gen with two N's. I would love for you to come along and feel free to pepper me with your questions, because I'm always more than happy to watch you grow and help you grow and help you be a confident growing nurse.
Beautiful. So that's gonna be the end of the show, Jen. Thank you for coming and thank you for, sharing these incredible stuffs. You said so many powerful statements and words, so I would have to listen to our conversation over and over again. Thank you so very much, Jen.
Anytime. Thank you so much for having me.